Hello students, in today's session we'll be discussing about the sexually transmitted diseases. Common sexually transmitted diseases could have an acute manifestation. Some of them will have a lifelong manifestations. Diseases like HIV and syphilis will have chronic lifelong manifestations that are there. You have diseases like hepatitis B and hepatitis C which have chronicity, associated malignancies that can happen. You have the acute diseases like maybe the Chancroid that is there, or maybe the urinary tract infection, urethritis, etc., which come only locally, and then they can have only a short-lived problems that you would see. Now, the most important risk factors is the unprotected sexual activity with multiple partners. So, these are the important risk factors that are there. So, you do find a lot of diseases in people who are having unprotected sexual activities, males having sex with males, people who are into drug abuse, people who are into illicit drug abuse, they are very common that is there. So, the other sexually transmitted diseases which are much more commoner, possibly a little more commoner in females, are the chlamydia, the human papilloma virus infection, and to a certain extent the gonococcal that we have. So, the common etiologies that we have is the herpes simplex, especially the type 2 that is there, the syphilis, that is the treponemal pallidum which produces the primary syphilis, Neisseria gonorrhoeae, that is the important organism that we have. Other than these, you could have the genital ulcers which could be caused due to trauma, it could be due to fungal infection, sometimes malignant ulcers could be there. Now, the risk factors, as we said, is high risk sexual behavior, multiple sexual partners that we have. Now, coming on to the genital ulcer disease, if you look at the various ulcers, so you could have primary syphilis which comes with the chancre. Now, chancre is a painless, non-tender, indurated ulcer with a firm, non-tender inguinal lymph nodes, very important. So, you could have single or multiple ulcers that could be seen there. In contrast, you could have the vesicular rash or ulcers that could be seen with the genital herpes. Even in chancroid that is produced by the Haemophilus ducreyi, they are painful multiple ulcers with lymphadenopathy that you would have. So, the common infections other than the ulcers, you could have the chronic pelvic pain syndrome. Now, in males it could be due to prostatitis, it could be due to urethritis, they could have fever, frequency of urination, dysuria, and recurrent admissions for infections that could be there. Sometimes they can have bladder outlet obstruction. Chronic bacterial prostatitis is also a very important feature, usually seen with either chlamydia, non-gonococcal, sometimes it could be fungal also. So, you would want to, a digital rectal examination would show a tender prostate. So, that is how you do it, and you can send a prostatic massage and then send the urinary sample, you will get the culture which is positive in that. So, how do we diagnose it? So, very importantly, history is important. Then we specifically, you could check for individual organisms, like for the chlamydia, we ask for the nucleic acid amplification test, that is the most, either from the vaginal swab or the cervical swab. Cultures is not very useful. For the gonococcus, simple is a gold standard gram stain and a culture sensitivity from the endocervical swab, etc. can be done. For the syphilis, you have the non-treponemal test and the treponemal test. So, you have the non-treponemal test, that is the VDRL and the RPR. The treponemal test is the fluorescent antibody absorption test that is there, and the treponemal pallidum particle agglutination test that is there. Also, you can do the dark field microscopy which can be done, which can demonstrate the particular spirochetes that you could see. For herpes, it is a predominantly clinical diagnosis. You can do the PCR for the specific antigen that can be seen. HSV DNA can be detected. Serology for HSV 1 and 2 antibodies can also be done. For the human papilloma virus, you can do the human papilloma virus DNA levels. Higher the levels, more the chance of cervical cancer. Pap smear can be done, and sometimes you might require to do a colposcopy and biopsy also from that. How do you manage? So whenever you have a clinical diagnosis, so how do you treat it? So herpes, the treatment is acyclovir or valcyclovir or ganciclovir. So that's the main therapy. Syphilis, the main therapy is penicillin that we give. So penicillin G, benzathine penicillin, 2.4 million units IM that we give. For chancroid, the treatment of choice is ciprofloxacin. We give 500 milligrams 1 dose, or ceftriaxone 250 milligrams IM 1 dose, or you can give azithromycin 1 gram single dose can be given. So when we look at the various syndromes that we have in the sexually transmitted diseases, you could have the urethral discharge syndrome. So that's a common. So if you see in the males, you have the Neisseria gonorrhoeae, you could have the Chlamydia, you could have Mycoplasma and Trichomonas. The vaginal distress syndrome, it could be due to Trichomonas, Candida, that's the most common, followed by Neisseria, Chlamydia, sometimes Trichomonas and Herpes also. The lower abdominal pain, classically with Neisseria gonorrhoeae, Chlamydia and that's PID in case of females that you get. Genital ulcers, as we discussed, it's herpes, syphilis, chlamydia, lymphogranulomanorum, Haemophilus ducrei, that's the chancroid, and Klebsiella pneumonitis. Anorectal discharge, again in prostatitis due to Neisseria, chlamydia and mycoplasma and herpes. The proctocolitis can occur due to the other bacteria like Shigella, Campylobacter, cytomegalovirus. The painful scrotal swelling in males, mostly due to Neisseria, chlamydia and E. coli that could be happening. So when we look at these various syndromes, you have certain drugs which are available, and as per the national guidelines, we have the 8 kits that are available. So kit 1 is what we call it as the grey color kit, which is containing a tablet azithromycin 1 gram and cefixime 800 milligram. Now this is for the urethral discharge, vaginal discharge, painful scrotum, and for a presumptive treatment. So anybody with STI will get this kit 1. The next kit that is there is the kit 2, which is the green kit, that is secnidazole 2000 milligrams plus fluconazole 150 milligram. This is basically for the vaginal discharge, so trichomonas as well as the candida treatment that's used for that. Next you have the important kit, that is the white kit, that is basically for the genital ulcer, especially syphilis and chancroid. So you are giving benzathine penicillin 2.4 million units IM, and you have a single dose of azithromycin 1 gram, that's for the genital ulcer syndrome. Next you have the kit 4, which is primarily for genital ulcers who have allergic to penicillin. There you give doxycycline 100 milligram. 28 tablets are there, that is twice daily for 14 days. These are given in patients for syphilis or chancroid along with 1 gram of azithromycin. Red kit, that is used for the treatment of genital ulcers which are due to secondary to herpetic ulcers. So acyclovir 400 milligrams, 21 tablets are there. So you are taking 3 tablets per day for 7 days. The kit yellow, that is basically for the lower abdominal pain and PID, usually in females. Cefixime 800 milligram single dose, metronidazole 400 milligram, 28 tablets are there. So you are giving twice daily for 14 days, and doxycycline 100 milligram, 28 tablets, that is you are giving twice daily for 14 days. The black kit is basically for the inguinal bubo, that is your lymphogranuloma venereum, that's the main treatment that you are using. So where you give doxycycline, you are giving 42 capsules. That means you are taking it for 21 days twice daily. The last new kit is come for the anorectal discharge syndrome, that is you give cefixime 800 milligrams stat and doxycycline 100 milligrams twice daily for 7 days. So these are the main therapies that we have for the sexually transmitted disease. Students, in today's session, we discussed the common sexually transmitted diseases. We discussed the approach, the diagnosis, the evaluation and the management.